want to talk about vulnerable seniors. United Way has done some groundbreaking research, and I was quite interested in the report that was specific to rural areas such as Renfrew County, where we have an aging population. That work is very, very important, and I would put an exclamation mark on it now because of the impact the pandemic has had on isolation for seniors. Why was that work so important to the United Way?
Well, for a variety of reasons, but first and foremost is that demographics are simply weighing upon us as a region, indeed as a society, and we now have proportionally more seniors than any other than we have as people under 15. And that's not going to change anytime soon. Our population is aging, and the challenges and costs of managing the challenges associated with aging are significant, frankly, social justice issues. The other thing that I think was actually very, very helpful to us is in the context of coming together as 4 regions, it was one of those issues that was common right across the board, that Ottawa, Prescott Russell, Lanark, and Renfrew all had comparable challenges around their senior population. The issues present themselves differently. In Ottawa, there are issues that pertain to the quality of service, the capacity for organization. In places like Renfrew, it's distance. How do you manage those distances? And the concentration of seniors. And so, but the challenges are just the same. People are isolated. People are need service, need support. In some cases during this pandemic, we found people that frankly, weren't getting food, weren't getting attention. All the usual connections that were available had been cut off because the economy had shut down. And so thankfully, again, with the support throughout the region of an organization based in Ottawa, but with services now right throughout the region and beyond, the Good Companion Center, we have a seniors center without walls. And so every day they convene by phone and check in and provides food services, food delivery, in some cases hot meals, and have support systems throughout the region to make sure that people don't get left behind. And in the early days, we found that those people weren't getting that service. The people who were delivering those goods didn't have PPEs. And frankly, they weren't asking. They were always believing that there was someone who was in greater need than they were. And we found people who hadn't eaten in days. And so it was tragic. And I think that things are much improved, but there's still a ways to go. The good news is, Jamie, and this I guess is the other thing that we've learned about the pandemic, is some of the things that we have learned, some of the innovations that we have discovered, some of the partnerships and alignments that we have forged will serve us well moving forward as times return. We have found that actually, although not ideal or perfect, there's a lot of things that can be done in the way that we are communicating today if there's the appropriate bandwidth and technological capacity. So we're going to work on that and make sure that's available. But there's a lot that can be done in terms of mental health supports, in terms of healthcare, in terms of just checking in and delivering those services to seniors that otherwise would be forgotten.